Chalo, chalo, look. Let's talk about the most important chapter in general pathology, that is genetics. It will give you 5 to 7 questions in the main exam. Genetics, study of genetic material. Two things in our genetic material, genes and chromosomes. Now, the study of genes is called as genomics, and the study of chromosome is called as karyotyping. Okay. So karyotyping and genomics मिला के genetics, we have 25,000 genes made up of 3.2 billion base pairs. These base pairs can be of two types. They have two parts, exons and introns. Introns, they are the non-coding part, and exon, they are the coding part. Now, maximum exon we can have is around 1.5%, and minimum introns we can have is 98.5%. Now, what are the examples of introns? They are your mitochondrial RNA, centromere, telomere, and transposon jumping genes. What are jumping genes? Which keep on changing their position. And we discussed in the class that how we are, naming a gene or not, how we are locating a gene. Location. That is your carbs. Chromosome, arm, region, band, and subband. Remember, there can be total 8 regions in a chromosome arm. Now, what is the phenotype? Phenotype is a morphological iteration of a genotype. And what is the genotype? The genes which you are carrying from your parents. Every gene has got two alleles. For each gene of your mother, your father's gene will be an allele. For your father's gene, your mother's gene will be an allele. So the gene is E. And how many alleles is that? Two. Chromosome, 23 pairs, 46 total. One pair of sex chromosome, 22 pairs of autosome. Largest chromosome is 1 and smallest is 21. Okay, not 22. On the basis of telomere, you have four types of chromosome. When the centromere is the center, metacentric, away from the center, submetacentric, towards the top, acrocentric, and at the top, telocentric. Now the chromosome X is your submeta, chromosome 1 it is meta, and chromosome Y is acro, and other autosomes which are acro are 13, 14, 15, 21, 22. And telocentric chromosome, they are not present on humans. Okay. Then the mutations are permanent changes in the DNA. Gene mutation, chromosome mutation. Gene mutations can be of two types, point and frame shift. And chromosome mutations can be of two types, structural and chromosome. Now, point mutation छोटू अपन ने 3 टाइप का किया था. When you get what you want, silent, no disease. When you get something else than you want, missense point mutation, sickle cell anemia. When you get nothing, nonsense point mutation, beta thalassemia. Frame shift, either deletion of a nucleotide, frame shifts backward, or addition of a nucleotide, frame shifts forward. Alpha thalassemia is the example. Then chromosomal mutations, numerical के अंदर छोटू euploidy, aneuploidy. When the number of chromosome after mutation becomes the multiple of 23, that is called as euploidy, not possible in humans. Aneuploidy, when the chromosome number one extra or one less. So 46 is the total number. Either it can become 45 monosomy or it can become 47 trisomy. Trisomy can occur from both the chromosomes. That means the extra chromosome which is coming, either can be an autosome or either it can be a sex chromosome. If it's a sex chromosome, then it is called as Klinefelter syndrome. 47XXY, the most common genotype. But if it's an autosome, we just write the number of the chromosome which is getting extra. Okay. Monosomy, just learn one thing that monosomy on an autosome is not viable for life. So monosomy can only occur on a sex chromosome. स्ट्रक्चरल म्यूटेशंस दो ही चीजें याद रखनी है बेटा वैसे तो इसमें एग्जांपल्स बहुत है इन्वर्जन इंसर्शन डुप्लीकेशन डिलीशन बट यू जस्ट हैव टू लर्न द ट्रांसलोकेशन और ट्रांसलोकेशन में भी व्हाट इज ट्रांसलोकेशन एक्सचेंज ऑफ आर्म द जेनेटिक मटेरियल इज चेंजिंग फ्रॉम वन आर्म ऑफ द क्रोमोसोम टू अनदर आर्म but you have to learn the Robertsonian translocation and in Robertsonian translocation it is seen on acrocentric chromosome like your 13 14 15 21 22 Y chromosome पे नहीं दिख रहा है and it gives you dicentric chromosome because you are having two centromeres because the end part of the chromosomes they are getting deleted. Isochromosome when the plane of division is perpendicular to the normal axis. So most common isochromosome याद रखना है इसको XQ. Ring chromosome when the end parts are deleted and chromosome make a ring. ठीक है. Now causes of mutation you have anaphase lag, non-disjunction during mitosis and non-disjunction during meiosis. So non-disjunction during mitosis it is going to give you mosaicism and non-disjunction during meiosis it's going to give you trisomy monosomy. I told you that any trisomy or any monosomy, the most common cause will be non-disjunction during meiosis. तो छोटो डाउन्स पटाओ टर्नर कुछ भी बोले वो मोस्ट कॉमन कॉज क्या है नॉन डिसजंक्शन ड्यूरिंग meiosis. ठीक है. नाउ पैटर्न ऑफ इनहेरिटेंस सबसे इंपॉर्टेंट चीज है छोटे मल्टी जेनेटिक भी होते हैं मल्टी जीन म्यूटेशन लीडिंग टू अ डिजीज क्लेफ्ट क्लेफ्ट डायबिटिक मेलाइटिस हाइपरटेंशन हाइपरकोलेस्ट्रोलिनिया बहुत सारी चीजें Single gene में it can either be a classical or it can be a non-classical pattern. So a classical pattern, Mendelian pattern. Non-classical pattern, non-Mendelian pattern. What are the classical patterns? Where both the parents are responsible in transmission of disease. Non-classical pattern, only one parent is responsible. And there is no rule of probability here. Everyone will be diseased. Either everyone will be diseased or no one will be diseased. So non-classical pathway में there are four patterns: genomic imprinting, gonadal mosaicism, mitochondrial inheritance, and TNR mutations. Whereas in a classical pathway you have autosomal dominant recessive, X-linked dominant recessive. और एक और है, that is your Y-linked. So अभी देखते हैं नॉन क्लासिकल में फर्स्ट इज जीनोमिक इम्प्रिंटिंग. चार पॉइंट है भाई. What is the other name? Silencing of a gene, and what is the cause? Epigenetics. In epigenetics, what is happening in the DNA? Methylation. DM याद किया था अपन ने. Now, what is the cause of the disease in genomic imprinting? It's deletion, because genomic imprinting in itself is not a cause of a disease. It is not a disease. What is happening in genomic imprinting, that out of the two alleles of the parents, one allele is not working. Only one allele is fine. So because only one allele is working, that's the only active gene we are left with. If it is getting deleted, it will cause the disease. So name of the disease is, is dependent on the allele which is getting deleted. If it's a mother gene which is getting deleted, Angelman syndrome. Father's gene deleted, Prader-Willi. But mother's deletion will make father duplication. So maternal deletion or paternal disomy will cause Angelman. The gene deleted as UBE3A and happy puppets. Whereas paternal deletion will also be called as maternal duplication. The gene deleted is not, and the people will be very serious. And there will be obese because of which gene mutation? Ghrelin gene mutation. सेकंड गोनाडल मोजाइसिज्म, एक ही लाइन याद करने के लिए बोला. पेरेंट्स एब्सोल्युटली नॉर्मल, ऑफस्प्रिंग अफेक्टेड बिकॉज ऑफ पोस्ट जाइगोटिक म्यूटेशंस. दिस इज द diseases which show gonadal mosaicism, but these diseases also can be transmitted in a patient via autosomal dominant way. So if somebody asks you these diseases are more commonly autosomal dominant or gonadal mosaicism, so autosomal dominant. ठीक है. Then comes mitochondrial inheritance, which is also called as maternal inheritance, because we know that only mother is transmitting the mitochondrial RNA, DNA. Papa नहीं transfer करते हैं. So if Papa is diseased by a mitochondrial disease, Papa will never transfer it to next generation. Only mother will transmit and transmit to all, because mother is the only one who is going to give the mitochondrial DNA to everyone. What are the diseases? KLMNO, P. You don't have to learn these diseases, but you have to learn that MELAS is the most common mitochondrial inheritance disease. But even in presence of MELAS, CPEO becomes a better choice. Chronic progressive external ophthalmoplegia. ठीक है छोटू. NARP also is a mitochondrial inheritance disease. Then TNR mutations, एक ही चीज याद रखनी है, Fragile X syndrome, CGG. Fragile X syndrome is happening due to FMR gene mutation, familial mental retardation gene. 5 to 55 CGG repeats are normal. 56 to 199 pre-mutated, and when we have more than 200, this warrants Fragile X syndrome. And बहुत ध्यान से, Fragile X syndrome is the most common inherited cause of mental retardation, whereas it is second most common genetic cause of mental retardation. What is the most common overall genetic cause of mental retardation? Down syndrome. And with Fragile X syndrome, you see anticipation that with progressive generations, the repeats and the severity of the disease increases. What is the most characteristic feature of Fragile X syndrome? That's always going to be macroorganism. Okay. This Fragile X syndrome, it has multiple ways of inheritance. It can be X-linked dominant, it can be X-linked recessive, and it can be mitochondrial, this non-Mendelian, where you have these nucleotide repeats. So three ways of inheritance, Fragile X syndrome. The most common way of inheritance of Fragile X syndrome is XLR, and I hope each one of you know that in XLR, males are more commonly affected than females. So in a Fragile X syndrome, which is the gender which is going to get affected more? Males. Then these Mendelian patterns, the autosomal dominant, this is the most common pattern. Okay. And in this, the disease will only show itself in the heterozygous form, because if both the alleles are mutated, they will fight with each other and the patient will die. So homozygous autosomal dominant mutations will get aborted. So homozygous autosomal dominant mutations are getting aborted. So autosomal dominant disorders, they are only showing themselves in which way? Heterozygous. This is the most common pattern. And which kind of defects? Structural protein defects. Disease transmission rate is 50% in these, and they will never show a skipping of generation. Every dominant hai to no skipping of generation. And these two patterns, incomplete penetrance and variable expressivity, they will only be shown by autosomal dominant pattern. What is incomplete penetrance? That people will have the mutated gene, but they will not show the disease in which it should be. they are not showing what the mutation is asking, and then they are not normal also. So they're not carriers, that they're carrying a disease and not showing it. I mean, they're carrying the disease, they're not showing what the disease is wanting, they're showing something else. And variable expressivity, that people who are showing it, they're also showing it in different magnitude. Some are very less symptomatic, some are very severely symptomatic, same mutations. So variable expressivity. The example of autosomal dominant is don't have A. So you have to learn. Most common is Marfan's, and Marfan to Marfan का mnemonic ही है. Most common problem with Marfan is mitral valve prolapse. Most common cause of death is aortic dissection, retinal detachment, fibrillin 1 gene beta. Fibrillin 1 mutation will cause Marfan. Fibrillin 2 never cause a disease. 9 feet height matlab they are tall. And revised Gantt criteria is the criteria by which we diagnose Marfan syndrome. Autosomal recessive, recessive matlab weak mutation, they're the second most common pattern. They only show themselves in homozygous. When both the alleles are mutated, then only the disease will occur, because if one is normal and one is mutated, who is more strong? The mutation is recessive, it's weak. So strong is this. So this patient will absolutely look to you normal. Now, these kind of patients who are carrying the mutations and never show the disease, they are called as what? They are called as carriers. So carriers are only possible in which mutations? Recessive mutations. And autosomal recessive can only show themselves in a homozygous form, not in a heterozygous form. In heterozygous form, they will become carriers. Whereas autosomal dominant, they only show themselves in heterozygous form. In homozygous condition, they becomes death in utero. The disease transmission rate is 25%, and the examples are A, B, C, D, E, F, G, H. They are enzyme deficiency disorder. X-linked recessive, again, weak mutations, so they will make female carrier. You can have a carrier female. Males for a X-linked disease will never be carriers. Male has only one X, so if it is weakly mutated, then also it will show itself. Strongly mutated, it will show itself. And in an X-linked disease, there are always crisscross inheritance. XLR, XLD, both will show you crisscross inheritance, that mother is giving to son and father is giving only to daughters. Because father never transfers the X chromosome to son. So father will only and only transfer to daughter. What are the examples? Akshay can fight dance, give him cold water. X-linked dominant, because it's a dominant mutation, no skipping. It's an X-linked disorder, so crisscross inheritance. And here, the male to female ratio will be equal because it's a dominant mutation. So even one X mutated in a female will cause disease. There are no carriers seen. So female also out of two X, one X is mutated, she is diseased. Mother is this male is also diseased. So they are 1:1. Whereas in XLR, it is always males who are more commonly affected, because in XLR, one allele mutated in a female will make her carrier, not diseased. The examples of X-linked dominant, fast car. So these are your autosomal and autosomal dominant recessive, X-linked dominant, X-linked recessive patterns. Very important for the exam. Now, for a genetic disorder, this you have seen in multiple subjects. Again, we'll repeat. Downs, trisomy 21, most common trisomy overall, most common cause is NDDM. Overall, most common trisomy is 16. I mean, but in living individuals, the most common trisomy overall is Downs. You'll have trisomy at 21st chromosome. This you can see here. All the patients have Downs after 40 years, Alzheimer's. Most common leukemia is ALL. But if the child age group is less than 3 year old, it is AML M7. Most common cardiac defect is ECD. If not given VSD, if not given ASD, two things you have to see: simian crease and sandal gap. The rest, everything, they're mentally retarded, mongoloid slant, flat nose, glabella, all this you already know. But for a question solving, this will be important. Simian crease, saddle gap, ECD, like that. Edward syndrome came in your exam. They gave the karyotype and they asked you what it is. So trisomy 18, because it's a trisomy, so NDDM. And I told you, learn, they will be mentally retarded, but they have what? Strawberry skull, prominent occiput region, short chin. They are having clenched fist, overlapping fingers, like that. In Patau, Patau में बेटा it is trisomy 13, and it is trisomy 13, and again the most common cause is NDDM only, and as I said, sab chota. So in Patau syndrome, everything is small. They also have mental retardation. They are also having clenched fist, overlapping fingers. But P for Patau, P for polydactyly. So remember that. Then comes Cridocott. It is chromosome 5p deletion and mewing like cry, cat-like cry. And then the George syndrome. This is your trisomy 22 beta. ठीक है, trisomy 22 cat eye. Then your chromosome 5p deletion, cat cry. But DeGeorge may you have to learn this is deletion of 22nd. So D for DeGeorge and D for deletion. Deletion 22, DeGeorge. Trisomy 22, cat eye. DeGeorge may the mnemonic is catch 22. So you are having cleft lip and cleft palate, abnormal faces, thymic hypoplasia and hyplasia. Cardiac abnormality में क्या होता है? Tetralogy of palate. They show hypocalcemia. Those, Chvostek sign and your, that twitching and the obstetrician hand because of muscle irritation and deletion of 26. So this is your discharge. And trisomy 22 अपन ने कर लिया vertebral colobomas in the eye, that is your cat eye. So these are autosomal disorders. And if they ask you like cleft lip and cleft palate is more commonly seen in, तो छोड़ो most common trisomy overall is 21. So downs में ही दिखेगा most common cleft lip and cleft palate. Sex chromosomal diseases, Klinefelter syndrome. In a Klinefelter syndrome, 47XXY. This is the most common cause because it's a trisomy, so NDDM, and it is the most common cause of male hypogonadism. Uh, More the number of X chromosome, worse is the prognosis, increased paternal maternal age causes more chances of Klinefelter syndrome. And the most common cardiovascular abnormality in the patients of Klinefelter syndrome is mitral valve collapse. They are very tall, near normal IQ, but 100% infertile. And the treatment can be hormonal replacement therapies. In a Turner syndrome, it is 45XO. Again, the most common cause is NDDM, and they are the most common cause of female hypogonadism. They are the cases of primary amenorrhea. Cases of primary amenorrhea, they have normal IQ, absolutely normal IQ. Again, hormonal replacement therapies can be given. Noonan syndrome looks like Turner, but it's not a sex chromosomal disorder. It's a mutation on chromosome number 12. And for Noonan, always remember, male will be more involved than female. So it's not a sex chromosomal disorder, but they have a normal genotype. Why I've kept it here? Because I wanted you to compare it with Turners. Because clinically they present like Turners, but they're not Turners. Okay? Then for diagnosis, fish, we discussed fish is the most sensitive technique, most specific technique, but for a new disease finding, you cannot do fish because fish cannot find out any new disease. The diseases which are documented, fish will find it 100%. Best technique. Antenatal testing, the first sample can be taken at around 9 weeks from the chorionic villi. For a pedigree analysis, but you need to know, the symbols, pedigree symbols, because they keep asking. And this is one thing, these symbols, you can make it also if you do not have them. So, male, female, तो आपको सब पता ही है, that a square is a male and a circle is a female. Now, what else you can learn if they have this cross? Disease matlab dead. So this is dead. These filled up, they are means they are affected. They are diseased people. They are having a disease. ये जो डिजीज लिखा है ना बेटा इसका मतलब डेड है. देन डॉट मतलब कैरियर है. ये सिंपल लाइन छोड़ दो. ये जो ब्रैकेट आया ना ये लास्ट टाइम विच केम. सो ब्रैकेट में दिया है तो अडॉप्टेड है. एंड इफ दे आर putting double line, that means consanguineous marriage, marrying in a relative. This is dizygotic. They might ask this time. ठीक है, डाइजाइगोटिक एंड मोनोजाइगोटिक में ट्राइंगल के अंदर पूरा ट्राइंगल बना देंगे. सो डाइजाइगोटिक एंड मोनोजाइगोटिक रिमेंबर. देन ये तो पता ही है रिप्रोडक्शन फैमिली बन रही है. ये मिसकैरेज, ओनली ट्राइंगल मिसकैरेज. इसके बाद लाइन खींच दिया टर्मिनेशन ऑफ प्रेगनेंसी. देन स्टिल बर्थ लाइक दिस दे विल राइट एस बी. अब देखो इसमें और इसमें फर्क क्या है. यहाँ पे इन्होंने एस बी लिखा है. दिस इज स्टिल बर्थ. हियर इट्स डेड. देन इफ दे हैव perpendicular sign with a line, infertility. और अगर खाली perpendicular sign है that means couple has decided not to have a child. Now we have to learn it, we have to understand it to solve the pedigrees. And pedigree solving beta rules you have to learn and rest you can apply. First of all, whenever a pedigree comes you see the options. When you're seeing the options, if there is a non-Mendelian pattern there, try to rule out the non-Mendelian one. How? If the disease is transmitting in all or transmitting to none. All or none phenomenon is seen with non-Mendelian. If you are seeing probability in a pedigree chart, it's Mendelian pedigree. It can't be non-Mendelian. Okay? So if you have decided it's a Mendelian pedigree, then you have to decide between dominant and recessive. So for that, you see skipping of generation. You go up to down and down to up. If a parent is diseased, one of the child should be diseased. If a child is diseased, one of the parents should be diseased. This means dominant. If you're seeing this, it's dominant. If you're not seeing this, it's recessive. If it's a dominant pedigree you have decided, then you see DDD. What is DDD? You see a diseased dad married to a normal mother, and this diseased dad should only give the disease to all daughters only and no son. Then it is X-linked. If any of this is not proved, it is autosomal. And if you find a recessive pedigree, diseased mother with a normal father, and this diseased mother should give the disease to only all son, and no daughter. Then it is X-linked. Otherwise, if any of this is not proved, it is autosomal. Okay. After that, there are two more things you have to add. Random involvement of individual in a pedigree. No rule is followed. Random involvement. It is AR. Only random male involvement. It is XLR. Only all male involvement. This is violate. That is it. Mitochondrial inheritance में क्या होगा? Only mother transmit. Father will not be transferring to anyone, and when the mother will transfer, she'll transfer to all. And in gonadal mosaicism, parents will absolutely be normal, but the progeny will completely be involved. This is your pedigree analysis. And this is a quick review of all the points of genetics. I hope you remember these pedigrees we have solved. And this will help you in completing your topics of genetics for the main exam. Try to see the Mendelian patterns properly and the pedigrees. I hope it helps. Thank you. See you in the next. Bye bye.